we will now move on to Amir. On Yemen, we know, as you also mentioned, it's facing amongst the most acute humanitarian crisis that we have globally. And millions of people are in need of urgent humanitarian assistance. There is famine, disease such as cholera. Now to that we're added the COVID-19 crisis, as you were saying. So what is the situation of COVID-19 in the areas that you are controlling, that you're operating? And what are the concrete measures that you have been taking also to help fight and counter the effect of this crisis? The floor is yours, Amir.
Yeah, I mean, thank you for this question. I think in our areas, in Yemen, I mean, Yemen was maybe the last countries that got COVID-19, but that wasn't the reason. I mean, it's not because of their access. I think it's because of the lack of test kits, of the identifying the disease. So till now, we have 70 cases, official cases, in Yemen as a whole, and in our areas, it was from the 70 we have 63 only in our areas, and we've got like 11 deaths at this right now. In Aden, for example, where the city where we have more leverage in, around 40, 45. But the thing is, for example, yesterday, we have around 70 deaths in Aden. But the reason, no one knows. What is it exactly? Is it cholera? Is it what kind of disease is it? So because of that, of the problems in the health system and the infrastructure and all the humanitarian situation in those cities and the bad condition, this is one of the problems that we couldn't really identify the disease, and at the same time we don't know how we have problem in solving these problems. From our side as an STC, we tried our best. We tried to make awareness campaigns. We tried to make sanitization to the institutes. We also tried to prepare a hospital especially for treatment for COVID-19, and now with the help of the MSF, I think now they are in control with that. We tried to facilitate for the WHO also to provide with. They just provided 2,000 test kits plus 7 ventilators. But as you know, this is not enough at all in our areas. So that needs lots of help, lots of international involvement in these areas. From our part, we'll try to provide the container for all this help from the international community, and we are providing, as Renee said, they want the grant, they want passage and security, and I think we can do that, and we are willing to do that. And at the same time, the problem in our areas, especially in Yemen, because we had lots of diseases before, and people are not taking this a bit serious now. And as Mr. Christian was saying, maybe if it gets worse, and maybe people will realize the seriousness of the situation, and maybe then they will take it to another step and think about it. But this also needs all the parties, political parties' role to take this seriously and take it forward. Yeah, we need the help of everyone, and we try our best to face this breakout, and especially in areas like Yemen.
Okay, thank you, Amir. I can imagine you are facing great difficulties, and I hope really that there will be more support to the work that's ongoing to help. And I guess awareness raising also is one of the key issues, as you said, if people are not taking it serious.